about to how to manage the fever cases. So I'm going to share you my clinical experience of last 15 years. Along with that, how I learned myself while dealing with the clinical while dealing with the fever cases, especially in clinic. All right. So whatever is the scenario, whatever is the problem, what kind of a fever is doesn't matter. What doesn't matter is that every physician must need to have these five things, right? Observation, be a reason oriented, and you need to understand the next patient, the next person, and you have to understand his human understanding. One important thing, you must need to have the courage to deal with any kind of a critical danger, or any kind of a problematic fever, or in any case, right? These are the only five things which makes a very successful physician. So again, I would like to welcome you all, uh, by myself and along with my team. Dr. Aarti is here, and also another consultant, Dr. Mukesh is here. Okay. So today we are going to start the session on homeopathic approach in fever management. Right. So that one important thing, that any physician or every physician must need to came across with the fever cases. We cannot escape ourselves from the fever cases. Right. This is a this is a very critical time for the beginners when fever patients come. When the kids or the children come with the high grade fever, that time we get panic. Oh my god, how to handle these cases? But we cannot escape from the fact. We have to deal with fever cases at anyhow. It doesn't matter what kind of a fever is it. It doesn't matter the fever is all about 103 or 104 or high grade fever, but you have to manage it at anyhow. And you know somehow we feel that it's a problem. Oh my god, fever patient comes with the fever, it's a problem for us. Okay, but I will tell you, this is also a great opportunity for every homeopath to deal with the fever cases. Once you can treat that fever patient, he will be here for a long time. Okay, he will not go anywhere. Once you manage the fever cases, that patient will not go anywhere. So that this is a great opportunity to you, right? So today we are going to learn about, today we are going to see about a very beautiful two cases. Okay, into that case we are trying to learn about how to go with the case. Okay, so in the content we will go through like this: a case of fever, then homeopathic management, again what kind of criteria, or what are the important points to be taken in the case taking the fever, what should be considerable in the case taking in the field. Other again we are going to see a case, and at the end I'm going to show you the 7 cardinal steps to manage any kind of a fever cases or acute cases, right? So be ready. Okay, and I think cases is the only best example to learn anything. Case will teach you the mater medica, the repertory, the medicine part, the clinical part, everything. So today we have a case of small child. Basically, I have two clinics, one clinic in Karanjan, another clinic in Amravati. So, this patient suffered with the fever before 3 days back, and they are trying to manage it with other medicine. Okay. So, since 3 days, he had a continuous high grade fever about 102, 103, and that was the winter season. Okay. So, that day, his father called me. Okay. And they at the midnight, and he told me, doctor, my child again develops the chills and the fever. Because that he already called me, but I could not able to go at that clinic. So I said, okay, I will come, I will see you at morning tomorrow. Okay. So he told me, doctor, again at night, I think it was about 11:30 p.m., right? And 11:30 p.m. So that's what he told, doctor, my bachu develops a severe shivering. Okay, severe chills along with the high grade fever. And during fever, he was in delirium. He was continuously talking. He was continuously muttering in the sleep. Okay. So I asked him, tell me something. So बोले, डॉक्टर साहब वो ना कपड़ा ही नहीं रखते बॉडी पे. He was throwing his covering. He was not able to tolerate any kind of a covering, not the blanket, not the bedsheet, nothing. Even though if we are trying to take him with us on the lap, he is not able to tolerate the touch also. He's so irritable, he's so angry, he's so restless, doctor. I said, okay, do one thing, I'm coming to Karanja and get back to me tomorrow morning. Okay. So that child was so irritable, and he was not irritated get also on the touch. That is the scenario was going on. Okay. So his mother told me that doctor वो ना नींद में डर भी रहा है. He was in fear also. Okay, because there was a delirium, so he was in fear also. Mother told doctor, he was throwing out all these coverings, but I know that if we remove his coverings, again the fever increases. That was the problem. So I asked him what is the cause? Why he get the fever? What was the problem with him? कुछ उसने खाया था क्या? He had any kind of cold things वगैरह वगैरह. So he said no doctor. The father told me, क्या doctor, even in the winter he's playing outside the home. Okay, but during playing he never used to wear the sweater or the winter cloth or the jackets or the jacket, all that. He's not wearing anything. So doctor, I feel that it can be because of this. Otherwise, doctor, there is nothing specific. And even after that, when he used to play, winter outside the home in the cold air, then fever start, doctor. Okay. So this was the scenario going on since last 3 days. Some hook or crook they managed somehow there. Okay. And next day they came to me. Before coming to the clinic, again he called me. Then before coming to clinic, second episode came. So again at morning, again fever start after chills. Then it starts with the running nose, severe coryza, severe lacrimation, tearings in the eyes. The eyes was like rubbing, redness of eyes. That was going on. And the fever goes up to 103 again. But at this time, child was completely dull. He was drowsy and he was completely irritable. So it was like seesaw, sometimes drowsy and sometimes irritable and angry. That was going on. So I asked him, let me know what else. So his father told me that doctor, he becomes so irritable and he's restless that he wanted to go at shop, and once we took it at the shop, again he wanted to come at home. So that was the scenario. So he's not able to get set at one place. He was completely restless. Okay. So I asked him, what about the thirst? So he said that, oh, bar pani pee raha hai. Every half an hour he want to have a drink. He want to have a water. I said, okay. So on consultation, when I examined, there was a fast, hard pulse. Dhad, 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 dhad was going on. Patient father told doctor साहब जब उनको गोदी में लेते हैं ना तो कंटिन्यू धड़ 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 सुनाई देगा. That was a tachycardia. They can feel the pulse, when they used to take him on a lab. So on observation also, his father told me that doctor, he was not completely sleepy. In fever, he was dull, and he's like closing his eyes like this. He's sleepy again, woke up, again sleepy, again woke up. That kind of a scenario was also then in fever. I asked him, जब उसको बुखार नहीं तो क्या हो रहा था? Whenever there was no fever, that time he was completely active, doctor. There was no any problem. Okay, so let's see the video of that patient, and then you can understand what was the condition, how the father told the details of that case. Okay. So once you know that, when you have to observe the this video properly, because you have to crack the remedy also, right? So yeah, so observe it carefully.
क्या हो गया था इसको?
David, you handling?
इसको बस 3 दिन से ऐसा बुखार है।
हाँ.
और रात में बढ़ जा रहा। कल रात को आपने कॉल कितने बजे किया था मेरे को?
It's audible, Dr. Aarti?
क्या हुआ था
I think.
तब इसको बुखार था 102 पॉइंट।
Yes, audible and visible also.
Good.
अच्छा, तो रात को तकलीफ क्या हो रही थी इसको? बुखार के रात में? तो बस बुखार था, तकलीफ कुछ भी नहीं थी। चिड़चिड़ सिर्फ आंग गर्म था। उसके लिए फिर इसको पैरासिटामोल दी थी।
Observe closely, especially the face and the eyes of the patient.
सुबह से क्या हो रहा है इसको? सवेरे उसको कोई प्रॉब्लम नहीं, उठा खेल रहा था, मस्ती किया, सब किया। 10-10 बजे घर 6 बजे उसको दे दिया था। उसके बाद सीधा अभी आधा घंटा पहले उसका ऐसा बुखार हुआ।
Till he is in 103 fever.
ऐसे चिड़चिड़, चलो दुकान पे जाना है, पापा के पास जाना है,
पापा के पास जाना है,
पापा के पास जाना है, बस ऐसे। और बुखार भी 103 पॉइंट पे जब भी चेक किया तो 103 पॉइंट था। और अभी भी आपने चेक किया तो
see his eyes
पानी बह रहा है,
closing and opening,
पानी का
completely toxic.
आधा ग्लास पी रहा है वो। कितने टाइम में? 1-1.5 घंटे की। 1-1.5 घंटे के दिन में आधा ग्लास पानी पिया।
half glass of water after every 1.5 hours.
आधा ग्लास एक ही बार पी रहा है कि आधा ग्लास 2-3 बार मार रहा है? नहीं, आधा ग्लास पी दिया, फिर 1-1.5 घंटे के बाद और आधा ग्लास।
आधा ग्लास ना।
Okay.
अच्छा ठीक है। अच्छा दुकान पे जाने के लिए क्या बोल रहे हो?
बस पापा के पास जाना
I
है।
want to go
बाहर जाना
at the
है।
shop,
बाहर
outside the
दुकान पे
home.
गए तो?
नहीं, घर पे जैसे मम्मी है तो पापा के पास जाना है, पापा दुकान पे रहते मालूम है उसको,
अच्छा
उसके लिए उसको दुकान पे जाना है। अब जैसे यहाँ आए तो फिर और बोला तो दुकान पे जाना है, या वहाँ जाएगा तो ऐसा बोलेंगे मम्मी के पास जाना है,
He's
ऐसा
completely
बोलेंगे।
बेचैन है
rested.
वो।
हाँ बेचेंगे।
अच्छा, एक जगह पे नहीं रुक रहा है।
See his respiration
बेचैनी है। अच्छा
so far.
चीचड़ में क्या कर रहा है?
Observe his abdomen.
टीचर बस बाकी कुछ नहीं, यही यदि मैं उठा के बाहर लेके जाते हैं इसको।
अच्छा, नाक भी बांध है।
He is so drowsy, right?
और कुछ तकलीफ इसके बारे में?
बस बाकी कुछ नहीं।
अच्छा, बुखार में बड़बड़ कर रहा है क्या?
गड़बड़ तो थोड़ी बहुत करता है, ऐसे ज़्यादा नहीं कर रहा है ना।
बुखार में नींद में
Observe.
बुखार में
हाँ हाँ।
अच्छा, बुखार में रो रहा है?
नहीं, ये अभी रोना चालू हुआ सुस्त, इसके पहले तक ऐसी पोजीशन नहीं थी।
सुस्त है नहीं क्या मतलब?
ये ऐसे तो आंखें सी बंद।
Drowsy, is dull. आंखें बंद कर रहा है, right?
अभी उसको अपन ने कितना निकला बुखार? 103।
He's sleepy.
हाँ
103.4।
103.4.
देखता हूँ। मुझे दोपहर में फिर से उसको ला के बताना थोड़ी देर में, 2 घंटे में।
You see him after 2 hours,
ठीक है ना?
right?
अच्छा ठीक है।
So, what I wanted to tell you, in your clinical practice, you must need to have a very good observer, right? Why is this so? Because this is the factual things. If you observe the patient carefully, if you observe the patient properly, you can get many hints. You can get a many points to, to reach to the exact minimum. Okay. So, now let me know that when patients comes with 103.4 fever in a clinic, then how to do, what to do. This is the biggest problem with us. Shall we go with the crocin, paracetamol, Ibc plus, or we have to give only homeopathic remedy? We have to give only homeopathic medicine. Okay. So for to have a very good, confidence in your clinical practice, you must have a very good observer. Okay. So how to go with this case? Okay. Because since last 3 days he was taking modern medicine, even though it was not helping him. So what to do? Okay. So even in the this is a short case, now in this case, where is the important point? What to where we can give importance in this case? What to consider while selection of this remedy? How to enter in this fever case? What can be your entry point? What to observe? What is the clinical importance? Shall we go with the respiration? Shall we go with the tachycardia? Shall we go with the sleepiness? Shall we go with the drowsiness or only high grade fever? What is the etiology? What is the cause? These are the these are the bombarding is going on in your mind when we taking this kind of cases. But today I'm going to tell you the simple criteria. Today I'm going to give you few points to deal with the fever management. So in any case of fever or in any case, you must need to understand the process. Okay. So patient never tell you the case in the step by step. You have to understand the case in the process. When it start, how it start, what was before the fever. Okay. Now the patient is in the fever, then how it feels, what is his mental state in the fever, what is his experience in the fever. Other than that, in the fever, how what it makes better. Does he like to be on the mother's lap? Does he like to go out? Does he like to go somewhere else? Okay. So these are the important points while taking the dealing with the fever cases. So never forget the process. Never forget the journey of the disease. Never forget the journey of the fever. So you have to put it while taking the case in your clinical practice on the right side of paper. Write down which is the first part, second part, third, fourth, fifth, and then understand the process. Now the patient comes to you like this way. Okay. So never forget the process in fever cases. Just don't go with the symptoms. Just don't go with the rubrics, whatever in front of you. Because in the back of the history of the fever cases, you will get the etiology, you will get the causative factor behind that, right? So that's why the process is important. And if patient are not going to tell you all this, you can ask the relative when it start, how it feels the patient, तो कैसा कर रहा है, how it makes it better or worse. This is the important point. So in this case, what was the process? In this case, the journey of the fever starts when he exposed to cold. What his father told, doctor साहब वो ठंडी में बाहर खेल रहा था without sweater, without jacket, and then I feel that then the fever start. I think this can be a cause. Okay, so when he played in the evening, in the night, outside the home, then he get exposed to cold, and then he went to the for the sleeping. Then chill starts. Okay. After chills, fever goes 101, 102. Aggression only at midnight. Aggression at night. Aggression at night. This is the important modality here we can know. Then he used to go to sleep. In the sleep, again he feel thirsty. What is the thirst? In small quantity, large quantity, half an hour. And in the fever, he does not want any kind of covering. He was throwing all the clothing. He was throwing all the coverings. He does not also like the touch. Touch bhi mat karo mere ko. Mat karo dad. I don't like it. I don't like covering. But what his mother told, cover nahi kiya तो आपका बुखार बढ़ रहा है उसका. That is also a problem. Okay. In the fever, he's restless. In the fever, he's completely irritable. He's angry. Along with that, in the fever delirium, he's also in fear. This was the scenario going on. See, try to understand the process. According to way we will going to, I'm going to teach you how to take a rubrics also, right? Other than the fever, when there is no fever, oh, khel raha tha. He was active, he's playing well. No problem, doctor. But again, fever started at the morning, and now the fever is 103. And after fever, there is a lacrimation. He becomes dull. He's restless. He want to go at home. He want to go at shop. He want to go again at the clinic. Again from the clinic. Again he want to go towards the father. Again the mother. This was the scenario once the fever goes high. Okay, this is the journey of fever. See now from 100 to 103.4 fever is going, right? So how to look into this case? How to learn in this case? How to go with this case? The first of all, before going to understand any case of in homeopathy, it can be a chronic or acute or fever. You must need to understand the journey. Once you know this, you can understand many things. So we have these some facts. We have some points. Fever and its symptoms. In its acute symptoms. Fever with the modality. Fever and the mental symptoms. Some etiology with some exciting factor we know in this case, and along with the concomitants, right? So if I have done your half work, right? Now tell me the remedy. What can be the remedy? Anyone guesses? There is a drowsiness, there is a dullness, high grade fever, exposed to cold. Okay, what do you think? My screen is visible properly? IT? Hello? Yes.
Yes,
Okay.
yes.
So what are the remedies in chat box? Who's going to crack the case? Bryonia, podophyllum. Yes, yes, yes. Uh, Dr. Ramadevi said, Gelsemium, Shamgapne, Razina, Bryonia. Fantastic. Wow. Few more cases, few more remedies. Shailendra Sharma said it's a podophyllum. Okay, okay. Any other people who want to tell the remedy? Okay, good. Bryonia alba. Asif said Bryonia alba. Arti Motwani said Aconite. Rohan Das said Bryonia. So okay, Bryonia. And think of. I also don't know what is the remedy. We'll tell you what is the how to go with this case. Okay. So in this case, right? So in this case, how to go in any kind of fever cases? Okay. So here I'm going to teach you. Here I'm going to share you one important point while dealing with the fever cases, especially while dealing with the fever cases. We have to separate the totality. This is called an art of separation of totality. You have to separate the totality of fever. You have to separate the totality of mind with the fever. You have to separate the totality of PQRS, concomitants, modalities, local symptoms with the fever. Also, okay. Once you do this, you will get the common group of remedies in your periodic in your repertory chart, or you will get the a group of kingdom in your period, your repertory charts. Then you can understand how to finalize the medicine. Okay. So in this case, we have these fever symptoms like fever, heat, cold taking. This is his etiology. First of all, this you must need to learn about these things in your clinical practice. Fever, heat, cold taking. In generalities, he was weak. He was dull. Okay, weakness, fever during. Fever, heat, uncovering, desire for. Okay, he does not want any kind of covering. Okay, fever, heat, intense, high grade. One or two children in. बच्चों में खाली very specific. The patient is children. Then stomach thirst, fever during. Mind was tossing about fever during. He was so restless. He was tossing. यहाँ जाना है, वहाँ जाना है, पापा के पास, मम्मी के पास. And sleepiness, fever during. So what it means? Now you see the observation in your clinic. He was completely sleepy. He was drowsy. Okay. So somebody told bryonia, somebody told gelsemium, somebody told aconite, somebody told podophyllum. So why this happens? Because we took what we understand in the case, we took their symptoms and we go with the remedy, right? But after that we get confused. Okay, so if it does not, we if we don't want to get confused, then try to take a fever totality different. So here we have pulsatilla, stramonium, sulfur, phosphorus, bryonia. They are very good. Chamomile and aconite. Okay, so these are the few remedies. Now we are going to understand only fever with the mind totality. Now again we are going to separate this with the fever and the mind. So here in the mind, restlessness, nervousness, fever during. Then most important rubrics: stupefaction. Okay, somebody is doing. Okay, no problem. Stupefaction as if intoxicated, hit during. Delirium fever during hit. So he was in delirium. He was in fear. He was completely stupefied. He was completely toxic. Okay, and tossing about fever during. These are the four mental symptoms we have. So we have, you know, separate this totality. Now we are going to merge up all this totality and let's see what comes. Okay. So even though in mentals we have chamomilla, stramonium, belladonna, pulsatilla, and aconite. Now there is no phosphorus, there is no bryonia, there is no podophyllum. So let's see. Once we merge up all the two totality together, and here we have this aconite, pulsatilla, chamomilla, rustox. Okay, belladonna and phosphorus. Now question starts: what to give? अभी क्या देने का इसको? रस्टॉक्स भी इंपॉर्टेंट रेमेडी है कोल्ड के लिए. कैमोमिला फीवर विद चिड़चिड़ करने के लिए है, एंगर के लिए, इरिटेबिलिटी के, रेस्टलेसनेस के लिए. Pulsatilla is also there because of coryza. Pulsatilla is, aggression by cold wind, aggression in winter. Belladonna is also there, which covers all the things. Aconite is also there. So what to give? Okay. So my dear friends, today I'm going to tell you one important thing जो हम हमारे क्लिनिक में कभी नहीं करते, बट वो करना जरूरी है. ओके, सो let me know once we have this totality, is this any importance of chills before fever? Is there no importance of periodicity and time of fever? Is there is no importance of etiology by taking cold, coryza, lacrimation, modality if modality on uncovering? Oh, important nahi hai, is important. Okay, now he telling again, I'm going out, want to go home. Again he becomes so restless, irritable with fever, delirium fever, restless with fever. Okay, is this important or not? We should take it in the repertory chart or not? Okay, तो हमको ये लेना जरूरी है. We must need to consider in our repertory chart. Okay, without chills, because this was in the process. No, first the chills start, then the fever. So we must need to cover the chills. There was a coryza, there was a lacrimation, there was a drowsiness. Okay, is this important? Yes, this is very, very important to consider. This also, we cannot go only that, that two totality of fever and mind and the fever. We also consider this. There is also importance of tachycardia. This is also importance of fast throbbing heart pulse. We have to consider all this totality. So where we will get it? So in fever cases, this is my suggestion, what I am using in my clinical practice. In fever cases, you must need to follow the Boning-Wilson repertory and Mori repertory. Okay. So once we go to the Boning-Wilson repertory, in the repertory, we have the exact rubrics for the chills. Okay. In Boning repertory, we have compounding, beginning with chills, then hit. Exactly. First chill and then fever. Okay. There are only 12 remedies. Again, this fever was pathological. Why? It was since 3 days. And after that, the infection starts. That's why there is a coryza. That's why there is a lacrimation. That's why there is a burning in the eyes. That's why there is a redness of eyes. Most important point for any infectious or a pathological fever, when patient become dull, he become passive, he become toxic, he becomes stupefied, means infection is. बच्चों का फीवर है, अगर है वो डल नहीं है तो इट्स ओके. बच्चों का फीवर है, if he having a fever and he's not active, he's dull, then something is going wrong. You must need to understand in your clinics. Otherwise, you will go with the remedy changing, and patient can go somewhere else. He can become a bad. The third rubric is fever time night. Fever aggression coryza with fever aggression uncovering. How this rubric comes? This is the most popular rubric. What mother observe. मदर ने जो ऑब्जर्व किया बहुत इंपॉर्टेंट है. व्हाट शी टोल्ड डॉक्टर, ही डोंट वांट एनी काइंड ऑफ कवरिंग, बट if he not covering him, again fever increases, again fever goes high. Doctor, this is the problem. Okay, so this is also important to have a two modalities: fever aggression erosion uncovering and fever amelioration uncovering by the patient. Okay, this is also important. Then what is the concomitant here? Fever, mind, delirium, anxious. Fever, mind, delirium, fear. Okay, then he becomes so peevish, he becomes so angry, irritable, idhar udhar jana hai, he becomes so restless. These all are important. Now here we have three totalities: fever totality, mind fever totality, and now we have a bone emission totality, right? So we have covered all the points, we have covered all the totalities. Now here we have remedy: aconite, belladonna, patchouli, naxomica, chamomilla, arsenic, again rust off. Okay, but what comes in all these three totalities is the aconite. Are you with me? I hope so. You are with me. Okay. You know, I am not here. We are not, in the race. कि किसका remedy correct है. Here we are to learn how to go with the cases. Here we are learn how to analyze, how to understand, how to separate the totality in fever cases. Okay. Once you get master in this now, you will OPD will run like anything. Will tell you. Okay. So along with the boric repertory, you will have a bone emission repertory. Use it. You will get the exact symptom. You will get a typical periodicity, typical journey or the process of the fever exact into the bone emission repertory. Chills, fever before or fever after. Thirst with the fever or without a fever. Okay. You have a chills with the heat only of single part. You will get in the bone emission, and you will get a diagnosis of fever in boric repertory. Okay. Typhoid fever, malaria fever, bilious fever, zymotic fever, septic fever, you will get there. So, what is left now? So, what is left now? This is a tachycardia. Okay. So, because we have know that there is a typical, increased respiration, throbbing heart pulse. Even the father can also understand. कि, अरे इधर अभी मेरे को धड़धड़ लगता धड़धड़. I can feel doctor whenever he's in fever. I can feel his palpitation. I can feel his pulse. Okay. So we know that this is a belladonna also in there. Okay. But my dear friend, what we used to do in clinical practice, this is a common mistake I also did many times. We used to blindly believe on repertory chart and go with the remedy. And what kind of rubric we used to take? जो मेरे को लगता है वो rubric लिया मैंने, मेरे को लगा फोर्ड वाला में दे दिया, अरे फीवर तो गया ही नहीं, what to do man? मेरे को लगा ब्राविन ने दे दिया, फीवर तो गया नहीं, what to do man? मेरे को लगा जेल्सिमियम ड्राउजीनेस है, डलनेस है, गिडीनेस है, अरे दे दो हो जाएगा. This is not like, okay. At the beginning, we did this kind of mistake, but my dear friends, we must need to go like this. What is the final judgment? What is the final decision? Is matter medical. And repeat is just a tool. So then go with the bone emission matter medical. Now read there. What is given? Read the first line. What is there? The pulse, mostly very full, hard and accelerated. Okay. The pulse, mostly very full and hard and accelerated. Okay. In the fever. What else? Patient uncovering or from the touch, internal chilliness with the dryness, and hot skin and disposition to uncover. So that was a disposition what we understood about the modality. Okay, it was given by Bonington in his matter medic. Okay, this is very very important. What else? With the feverish restlessness and intention to uncover. Again, it was given. So this is given in matter medica. Exactly the pulse. What Boric told. बोरिक साहब ने क्या बोला है? He's mentioned in his matter medica, clinical matter medica. Boric is a clinical matter medica. He written there, thirst and restlessness always present in aconite. What? In aconite, thirst and restlessness is always present. This is very very important to take a references from different matter medica. Now here we get confirmed that our medicine is aconite. Okay. So see after 2 hours, what was his condition? Let's see. So why I'm sharing you these things, because what we used to do in every time we are trying to come with the remedy. We directly jump on the remedy, but never jump on the remedy. Try to understand try to understand the case first. Try to understand the important PQRS. Try to understand the unknown rubric. जो पता नहीं है उसको importance दो. आपको जो rubrics पता है ना वो डालोगे तो आपको वही remedy मिलेगा जो आपको चाहिए. I'm telling you again, जो आपको चाहिए वही remedy मिलेगा. So don't go with this. Okay. Sound आ रहा है क्या? Please check.
No sound.
Now see now. Okay. Now see his follow-up after 2 hours. Is it okay now?
Yes, yes.
Yeah. So patients come
कैसा है
himself
आपको अभी?
is
कैसा है?
active.
सर्दी है क्या? सो जाओ.
Now he's following our command. He's obey our command. He's sleeping now.
तकलीफ क्या है? रणबीर,
क्या बताओ बेटा?
You can compare yourself.
पानी आ रहा है?
पानी आ रहा है नाक में से.
He's observing here and there. He goes on exam table himself.
कैसा है आपको अभी?
He can feel the surrounding.
कैसा है? सर्दी है क्या? सो जाओ.
Okay. So yeah. So this was the scenario after 2 hours. So I told him just meet me after 2 hours. So after 2 hours, there was no fever. He was completely active. What was there? Only the running nose. Okay. So without giving any kind of a paracetamol, without giving any kind of a antipyretic, other modern medicine, he was completely okay. So you know what happened here? Okay. So again, I'm telling you, medicine doesn't matter. It comes. What matters that how the process, how so beautifully, so artistically you come to the remedy. Not only with the with the repertory, along with the references. Even in these references, what Farrington written here, okay, in the Aconite, he also mentioned that we find it indicated in genuine inflammatory fever. Genuine inflammatory fever. What was that? It was a pathological inflammatory fever because that's why there is the running nose, cold cough, and uh, we can say redness of eyes and lacrimation. Right. So now we are going towards the criteria. What are the other deeper points for what we can give importance while dealing with the fever cases? Okay. So here are some 11 points. I'm going to read it fast. Then we'll go more detail into that. After that, we have a small beautiful case of a child. Okay. So important point to ask in a fever management is that diagnosis. Okay. You must need to understand your clinical practice. The diagnosis is very important. Though you are a homeopath, I think every homeopath must need to understand, must need to go with the diagnosis of the case. Then etiology or exciting cause. Okay. Always consider the exciting cause. It can be a physical cause or mental cause. Other than then the stages of the fever, stages of the disease, journey of the disease, process of the disease. You must need to follow. What comes first, what comes later on, what was the where was the episode when the fever comes up. Okay. Then the observation. In pediatric cases, in acute cases, in clinical practice, you must need to have the art of observation. Will tell you. Okay. And this should be considered in your repertoire, my dear friends. Other than this, the activity of the patient in fever cases. He does his active, does his passive, is dull or toxic. It's important. Okay. For what he is sensitive, for what he is more reactive, you must need to understand. Concomitant. If you get the concomitant, it's fantastic part because concomitance is the kind of a you know sure point, a factual point or anchor point on which you can rely, on which you can take a rubric and you can rely. You can have a faith on that remedy. Now, if you are concomitant. Other than this, most important part for the beginners also, ये सब नहीं मिला तो at least you can have a local modalities, local level symptoms, LSMC. ये बहुत important है. Okay. Then the clinical examination. I have seen many of my friends, I have seen many of homeopaths, they are just only talk with the patient, never examine the patient, and I don't know how to go with the how they do with the clinical practice. But my dear friends, I would like to tell you, as I did RMSship, as I did locum in other modern medicine. So clinical examination is one of the most important part in any case because patient is not a doctor. He will not able to tell you what is happening in his throat. He cannot tell you, doctor, I have a pharyngitis. See, there is a redness of throat. Okay, doctor, see there is an appendicitis in my abdomen. इधर है ना, palpate करके देख लो, इधर appendix बिल्कुल दिख रहा है मेरे को. It will not happen. Patient will not tell you, doctor, I have I have a pneumonia in the right lungs of lower lobe. Okay, so देखो इधर पानी भरा हुआ है. ऐसा नहीं होएगा. It will not happen. You must need to understand the clinical examination. Where is the murmur? Where is the crepitus? Where is the wheezing? Where you feel that kind of a crepitus, left side, right side. So always examine the patient. Then the physical generals and most important part of the past medical list. Does he come with the steroid? Does he come with the antibiotics, antipyretic treatment? Nowadays, this viral fever is going on. Every patient comes with the steroid and Allegra and cetirizine tablet, medicine. After that, he came to us, अरे हुआ नहीं, अभी गया नहीं है, डॉक्टर कुछ करो. So after taking steroid and that Allegra and all that, patients suffer with the severe cough, severe dry cough. Sometimes there is a sputum. Some people comes with the dry cough, some people got the sputum. And now our remedy can be. But you must have to ask, have you taken the autoimmune medicine? Then we can increase the potency. So this is the importance of taking a past medical history, past medicinal history. क्या लिया, क्या नहीं लिया. Otherwise, patient comes to you, doctor, he has a loose motion, no? Okay, along with the fever, you will take the rubrics. No, diarrhea with fever. Have you asked him that he has taken antibiotics? Does he sensitive to antibiotics? अरे हाँ डॉक्टर, उसने एंटीबायोटिक लिया तब से लूज मोशन चालू है. Now what to do? Which rubric you will take? Fever or diarrhea, or sensitive to antibiotics, or sensitive to allopathic medicaments. So that's why this is the importance of taking a medicinal history. Okay, this is very important. Okay, old age person comes to you, doctor, see now after just little injury there is a continued bleeding. I am not able to stop the bleeding. Now you did all the investigation, no hemophilia, clotting time is normal, bleeding time is normal, nothing is there. What to do? Now you try to give the anti-hemorrhagic remedy. अरे उसको phosphorus दो, अरे उसको lycosis दो, अरे उसको protocols horridus दो, अरे उसको hemophilia, उसको क्या hemimelis दो, अरे उसको carbovex दो. अरे ask him, Baba, what medicine you are taking? He is taking ecosprin since last 30 years. So if he is taking ecosprin last 30 years, there must be a anticoagulant tendency in the blood. Now you have to reduce or tapping the doses of ecosprin, then everything will be okay. You have to stop or reduce the doses of aspirin, then the bleeding will be stopped. Or most of the old age people comes with their petici on the skin. So this is the importance of asking a medicinal history to the patient. Okay, this is the short. I know these are my clinical lessons what I'm sharing with you. Right? This is very important. Now let's go ahead. Otherwise, we will go to the out of the track. Okay, fine. So let's come with the most important and exciting part of the fever cases is etiology. Exciting cause. This is the damn sure part of the clinical practice that where you can rely, where you can give a faith, where you can get exact rubric to select the remedy. Okay, it can be a mental cause or it can be a physical cause. So what's there in mental cause? There is the anger, jealousy, anxiety, anticipation, homesickness. Okay, with that boyfriend, along with my boyfriend, there was another girl. She was so beautiful. I feel jealous and fever starts. What to do? Like you say, Ignatia. Okay, यार, my girlfriend went with some another boyfriend. Again fever start. आज जाना ही है, मूड नहीं है, देवदास बन गया मैं. Fever starts. What to do? There are so many mental and emotional exciting causes which is important in fever case. And you have a rubrics also. You have rubrics: fever, heat, anger, exhaustion, aggravation. Fever, heat, cares, worries, aggravation. Fever, heat, conversation, serious aggravation. Fever, heat, fright, fear, aggravation. There are many things. So here today, along with the hints, I am also came to you along with the rubrics. So here, so fear. Let's consider the fear in kids mostly. Yes. I remember one of my friend. She called me and she told me, doctor, sorry, Pravin. I said, क्या हुआ? What happened? अरे यार, मेरे बच्चों को ना कल से फीवर आया. मतलब क्या हो गया? अरे कुछ नहीं हो. They were playing like hide and seek at home and suddenly light goes and he was screaming like anything. I said, okay. Then what happened? Whole night he was in fever. He was in fever. Along with the fear, he had he developed the fever. Okay, what happened? He was muttering. He was in a delirium. Okay, then what to do? So she told, I gave him aconite. I gave him, stramonium because he was streak and he had a, fear of dark places and he was a fear. Okay, okay. Then nothing happened, yaar. Do something. So open the repertory. Okay, go to the fever, fight fear aggravation, opium, give opium. That's it. It's an important remedy. Okay. So what will happen? Blindly we go for the stramonium. Blindly go with the aconite. No, brother. We have the exact rubrics. Okay. So this happened. I would like to share another case also. You know, uh, two parents comes with a teenage girl. She was in first year. Okay, she came to me and parents told doctor इसको ना कल से 2 3 4 दिन से हफ्ता भर से बुखार चालू है. मतलब what happened? क्या हुआ वही पता नहीं डॉक्टर साहब को. She is not talking with us. Just she was in fear. She was in a fever. I said, okay, what happened? Let me talk to her. She came to me and okay, tell me what happened. What was the problem, beta? There was nothing. There was a silence and tears rolls on like this. Okay. बोला इसको बुखार है रोते जा रही है let me tell me something what has happened I'm trying to trying to find out the etiology is there any another cause so she told me nothing doctor tell me what happened anything any problem I said no for father scold you no you failed in exam no then what happened mobile gum gaya bole no so what happened nothing I asked him silently breakup and then suddenly she sobbed well okay that is the cause here is the cause breakup. Okay. But tell me what happened? What happened in the breakup? She told me, doctor, we have a love since last 10 years. Okay. School से हमारा love चालू था. Breakup हो गया. And since last 1 week, समझ ही नहीं आ रहा मैं क्या करूँ. I was completely in disappoint. So go to the repertory, open fever, disappointment, love. That's it. You have single remedy, phosphoric acid again. Okay. So you thought about ignitia, you thought about antimpurity, you thought about natrium, love disappointment. But again, we have a phosphoric acid, a single remedy. Go to the repertory, open. You will get this. After giving phosphoric repertory, slowly she was better. And when she come to normal, father told me, doctor, she is so active, she is so attentive, she is so clever. So what happened? Her remedy basically belongs to the phosphorus element, and she was in tubercular myelin. So into the failure side of miasm, she went to the field. That her remedy was phosphoric acid. Okay. So in anger, we have typical rubric in Murphy's fever anger with. You have chamomilla, you have noxumica, you have sepia, tapisagria. This is tapisagria, one of the most important remedy in cancer miasm. Who suppresses anger. After suppress the anger, fever starts. Tapisagria, chamomilla. After anger will become so uh, you know uh, we can say he becomes so irritable, so angry, so taciturn, and then fever starts. So here we have rubric. Go follow these rubrics. Go and understand. Read the repertory into the depth. Read the repertory in the detail. You will get more and more exact rubrics along with the mental etiology. These are the excitement causes where we can ask in the patient. You will get the exact remedy. Other than most important part is anticipation. Anticipation with the fever. Okay, now tell me, nervous chills, slow pulse, fainting kind of a condition in a fever. What can be remedy? Yes, come on, fast. Type in a chat box. Nervous chills, slow pulse, and fainting kind of a condition. What can be remedy? Anyone else? Gelsemium, Priyanka said. Gelsemium, Arti said. Okay. What others? Yes. Gelsemium giant. Yes. Okay. Yes, exactly. The remedy is gelsemium. Because most of the time we give them ignitia because of fainting. But my dear friends, you can see around you that you are someone, especially in the girls, before the exam they feel nervous chillness. What happened? अरे अभी मेरा exam है, shivering हो रहा है मेरे को. I don't know what is happening with me. I feel so shivering, so trembling. I feel like a faint. I feel like a chakkar आ रहा है मेरे को अभी. I feel so anxious and now I feel feverish. I feel hot flushes on my head and the ears. Okay, Gelsemium. Anticipating fever. What is the remedy? Especially anticipating fever. Okay, कल नोटबंदी होने वाला है. होगा नहीं होगा, fever starts. That is the problem. Yes, yes, Dr. Zayan. And Noxumica is the only remedy given in Matra Medica. Okay. आज शेयर मार्केट डाउन हो गया है, कल बढ़ेगा नहीं बढ़ेगा किसको पता, फीवर स्टार्ट्स. कल लड़के वाले देखने के लिए आ रहे, पसंद करेंगे नहीं पसंद करेंगे पता नहीं, रात भर में फीवर स्टार्ट्स. That is a Noxumica. But my dear friends, what is the difference between Noxumica and Gelsemium? I will like to tell you. Noxumica fever always comes with anticipation, with irritability, anticipation with anger, anticipation with restlessness. This is a typical differentiation of Gelsemium and Noxumica. Noxumica fever never comes with dullness. He always irritable. He is so sensitive in fever, in antihistamine. He does not like any kind of a noise. Touch mat karo, tum jao idhar se. I wanted to be in my room alone. Don't disturb me. लाइट वाइट बंद करके बैठ जाएगा. That is a typical anticipating fever for the Noxumica. He will never show his anticipation, but he is in anticipation. That is the anticipating fever. And the only single remedy is that is nothing but a Noxumica, right? So what are the other physical causes for the fever? For the other physical causes are cold, worms, food, weight, heat, alcohol. Okay, there can be an injury, there can be an accident, there can be a shock, there can be an electric shock. There can be a blunt injury. There can be anything. There can be fever after hard work, fever after a long walk. I मैं इधर गया चलने के लिए. I have a trek and after that fever develops. Okay, these are the typical exciting factors you must need to rely on that. These are the typical exciting factors you must need to give importance for all these things, because in any fever cases to enter a case, your first rubric, your first symptom should be a exciting cause. It can be a mental or it can be physical. ये note कर लो. It's a very important. This is the most important point. You cannot go without this remedy. Sorry, without this symptom, without this cause. Okay, it's most important point. Okay, what else? Another important point is diagnosis and investigation. This is the most important part after the exciting cause. Okay, so why is this so? I will tell you, because in my clinical practice at the beginning, I have never went with the investigation and diagnosis. I thought that कि patient को खर्चा क्यों करने का? Why we need to go with the investigation? करेंगे ना ठीक ठाक होम्योपैथी से. ऐसा नहीं होता है. Okay, so this is my advice to for all doctors and all the beginners if they are going to start the clinical practice. If patients come to you with the fever more than 5 to 7 days, always go with the investigation. Always go for the blood test. Always go for other investigation. Why is this so? Because this diagnosis can helps you to select the remedy. In your repertory, there are many diagnostic fevers. This helps you to select a selective remedy. Then you will have a selection of remedies. You can go with this in your clinical practice specialty. Okay, right? So, example, we have a fever with chills. What to do? If you have a fever with perspiration, if you have fever with vomiting, fever with weakness, fever with cough and breathlessness, more than 8 days, 10 days. Okay, if fever which is good, then it can be malaria. Go for a MP Vidal. It can be fever with perspiration. It can be typhoid. Fever with vomiting. It can be a jaundice. It can be a food poisoning. It can be appendicitis. Okay, fever with severe weakness. It can be an inflammatory fever. There can be an infection. There can be a leukocytosis. There can be a reduced TLC, increased TLC. Anything. Okay, so here in your repertory you have a typical rubrics like typhoid fever, dengue fever, malaria fever, disease specific fever. Okay, so what do you mean by disease specific fever? If patient already have a nephritis, patient already have a hepatitis, patient already have a cirrhosis of liver, patient already have rheumatoid arthritis, already have a jaundice, and then you will have a fever with nephritis, fever with hepatic involvement, fever with arthritis. What is the remedy? Anybody knows? Fever with rheumatoid arthritis, fever with rheumatism. Anybody knows the remedy? Okay, but मैं बाद में बोलूँगा. Okay, so these are the things how we can go with the fever case. Like, what is another important part is 450. Okay, what is another important part is investigation. Okay, always go with the investigation when fever is more than 5 to 7 days or 10 days. So how it helps? How it helps? Now, I would like to tell you that in first COVID, most of the diagnosis depends only on investigation. What was our first investigation? That was CRP. If CRP is high, then अब इसको कोविड हो गया, ऐसा हम लोग समझते थे. But along with that, we also used to go with the TLC, CBC and HB, right? Then you can understand, अरे इसका WBC down हो रहा है, lymphocyte भी down हो रहा है, infection बढ़ रहा है, then go with the CR, chest, CT scan chest. Then it helps, or either patches that kind of. So that why importance of investigation fever is very very important. Okay, this investigation helps you to diagnose the disease. It's malaria, typhoid, dengue, or it's just a sepsis fever. It will help, and this helps to select the remedy. Along with that, if fever decrease or increase, it helps to understand the TLC level, WBC level. Okay, if there is a decreased TLC, it can be an inflammatory or destructive fever. It can be a septic fever. There must be an infection. Then try to understand what can be infection. If increased neutrophils or decreased lymphocytes, you can understand. So just a viral fever. Don't worry, ho jayega. Within 3 to 4 days, we will give you viral remedy. And now you can calculate what are the remedies which helps to in a viral fever in homeopathy. You can go like this way, right? Increase eosinophilia means there must be a URTI or LRTI. Increase eosinophilia with the fever, matlab patient must be having a allergic infection. Patient must be having kind of a itching somewhere else. Patient must be having a boil tendency. It can also leads you to understand increase the eosinophilia. Accordingly, you can go with this. If patient having a boils with the fever, you can go with silica. Right, recurrent boil tendency with the fever. Okay, go with the silica, no any problem. If patient having a fever with increase in eosinophilia and later on he develops the cellulitis, you can go with apis, no problem. There we have specific remedy, na. So why not we give importance to the investigation? Just think like a modern medicine doctor. Just think like a real clinician. Think like a other physicians those are practicing modern medicine, and then you can apply your homeopathic medicine in your clinical practice. It helps a lot. I will tell you, it helps a lot. Okay, so nowadays in second, into the second wave, there is only a shivering and the fever. Okay, fever with shivering, diarrhea, and cold cough. This was like a first stage of COVID-19. That was like a cytokine storm. Then you have a different remedy. Into the blood test or in the second wave, there is no as such changes. There is no so much increase here. There is no so much destruction of WBC. Okay, then you can understand there is just an inflammatory state into the this COVID. Though your COVID is positive, now in this stage there is no as such mortality rate. Itna death nahi hai. Okay, we must need to understand this for only with the investigation. What else we can understand? Okay, if into the investigation, this is the most common part we are dealing with the homeopathy. It's very difficult to handling a dengue fever. It's very difficult to handling a typhoid, deep critical typhoid fever with reduced platelets, with destruction of the platelets. Okay, this is very very dangerous. Okay, but still we have rubrics, we have indications, we can take a help of preparatory with specific rubrics. Always go with the rubrics. Okay, so we have rubric at dengue fever in first stage and hemorrhagic stage. So what is meant by hemorrhagic stage? There must be a reduced platelet below than 30, below than 20. Then we can use this remedy also. Ferrum, sulfuric acid, one of the most and common important remedy we can use in dengue fever in critical stages where there is a reduced platelet count. You can go with sulfuric acid. Along with the, I would like to tell you also you can go with the Crotalus horridus. This is also important remedy. We can help in a reduced platelets, not only in dengue. Okay, Crotalus horridus helps you to recover the blood disorganization. Along with the septic fever, along with gas gangrene, along with the wet gangrene. Okay, that there also you can use Crotalus horridus because Crotalus horridus is having a typical tendency to recover the blood disorganization. Because in fact, I also told you many times in my last lecture that in ICU they are using only injection prolactin, and that injection is nothing but a poison of Crotalus horridus. Okay, important remedy. Use it. You can have these rubrics. Don't worry. Go specific. Okay, if you have a recurrent malaria and typhoid, also think of, you can also go with like this. If there is a blood problem, if there is a hemorrhagic tendency, think of alumina. Okay, so why I'm showing you these things, because these are also important points according to the investigation. If you don't know there is no platelet count reduced, what kind of a rubric you will take? जब आपको पता ही नहीं है कि उसका प्लेटलेट डाउन है तो रुब्रिक क्या लोगे आप? You will always go with the fever, high grade fever, high grade fever. Arey, we have more specific rubric like blood disorganization, blood sepsis pyoemia. Okay, blood coagulation difficult, blood coagulation thin, black. We have different remedies. Okay, so I'm trying to show you that how we can go, to take a rubrics specifically along with the investigation. Okay, most important part. Other than that, this is a third important point which you can ask in a case taking, that is journey of the disease, that is process of the disease, stages of the disease, or the pattern of the disease, where you can understand how to take rubrics stepwise. Okay, always ask the onset, always understand the course, always understand the episode of the fever, and at the end ask them कि ये end कैसा हुआ, fever कैसा गया, at the end how it feels. Okay, this is very important. फीवर फॉलोड है कि फीवर बाद में है, चिल्स बाद में है कि फीवर बाद में है, थर्स्ट पहले लगा कि पहले फीवर आया. This is very important, and for that you have a typical, you have a, you can take a help of Boni Krishna repertory. It's given so nicely along also with the, Boric repertory. There is given concomitant given so nicely in the Boric, and exact, very specifically they have given. Okay, so use these both repertory, and you can take a references from the Boric and Pathak Matramedic also you can take a references from Farrington Matramedic. Okay, so in this episode, or in the process or the journey of the disease or the fever, always try to ask the patient कि कैसा feel हो रहा है, what was his behavior, and that mental symptoms in the journey or in the process of fever you can take as a root. Okay, this helps to understand the pattern of the disease. Why? Because if you don't know when fever increases, अभी 101 था, 102 से फिर डाउन हुआ क्या, फिर अप हुआ क्या, this pattern will helps you to understand your prognosis with the remedy. If you are repeating the doses, if you are giving the water doses, if you are repeating the doses of your medicine, you must need to understand the pattern of the fever also. Then you can taper the dose, or then you can stop the doses. Right? This is the most important point. Okay, so along with that, now we have a second case. Okay, and this second case is homework for you. You have to crack this case at present here. So keep the repertory or a software along with you, because you have to solve this case, and after that we are going to end the session after this case, because I am not able to finish this case for this session. We will come with the second part also for to fulfill the other portion of the fever management, right? So this is a case of a child. Okay, he also came with his parents, and I would like to share some history. This 4-year boy consulted me with the fever, running nose, congestion in the throat, and severe kissing tonsillitis. Okay, severe kissing tonsillitis. So I asked him what happened. They told doctor, we went to the Yavatmal, we were nearby place, and at night they traveled from Yavatmal to Karanjan. Okay, and that day there was a completely rainy and cloudy atmosphere, doctor, and there was the cold winds was going on, and we traveled at night, and then they came to home. After coming to home, child starts running nose, child starts sneezing. There was a irritation in the throat. He was like, and they saw that, oh my god, there was a tonsillitis. And at midnight, suddenly he developed the high grade fever. It was about 102, 101. Okay, and mother told he was completely restless and crying all the time. He was not able to sleep from 2:30 a.m. to morning 6 a.m. He was like with him all the time. He was not able to sleep. And in the thirst, there was a small quantity of water in small intervals. छोटा थोड़ा पानी थोड़ा थोड़ा interval में पीता. That was the scenario. So during fever, he was crying and wants uncovering again. Want uncovering in this case also. So this was the case. So let's see. Uh, here I'm going to show you the little bit history by his mother and how to examine the case, how to examine a patient. Okay, let's see. So why examination is important in this case, I'm going to show you, and along with that, what is the importance of observation, you can understand it. Okay, so while talking with the patient, always observe the patient, what he is doing, what he is not doing. Okay, so IT, just let me know screen is there.
Yes.
Yeah, and just let me know the voice.
Yes, voice is there.
Yeah. So listen, carefully listen it.
साथ में क्या तकलीफ है?
रात को परेशान है,
He was not
रात भर
slept
2:30 बजे से
whole
लेके
night.
तो सवेरे 5-6 बजे तक।
क्या किया उसने बुखार में?
What he did in the fever? He was crying. He was sleeping.
पेट दुख रहा क्या?
उसने
Nothing.
पानी कितना पिया? प्यास वगैरह है?
2 ग्लास।
रात भर में एट ए टाइम एक गिलास
Always go in detailing for the thirst.
थोड़ा थोड़ा
In
पी
acute
रहा
and
था
fever
या
cases.
थोड़ा
मतलब थोड़ा थोड़ा देर में उसको प्यास लग रही थी। बुखार में भी?
हाँ,
In fever also.
बुखार में सुस्त था कि एक्टिव था?
सुस्त था।
He was dull in fever. He was
ये आज
drowsy in
सवेरे
fever.
तक सुस्त था।
ठंड वगैरह लगी उसको? कुछ पता है उसने?
कल शाम को ऐसे उसके पाँव में ऐसा लगा।
There was trembling and shivering.
हाँ, यानी वो रखता ही नहीं है।
He was not keeping anything on the. He was throwing the coverings. रखता ही नहीं है.
ये हो गया ऐसा?
Okay. So that was. And now see. And now see second part about the clinical examination. Okay. So he was like sleeping on the examination table, and then I went there. Okay. And now see how he reacts.
क्या हो गया प्रचीत?
4 years boy. What happened, Prachit? Said I have a cold and cough. Okay. I asked him कब से हुआ? सर रात से है.
क्या हुआ है? बहुत बुखार था?
सोया नहीं बोलना मैं।
I'm trying to understand, is there any URTI because of cold and cold air? Voice is completely nasal speech. His nose was
नाक
blocked.
से छुआ हूँ रात में।
No.
शायद उसका नाक पैक हो रहा है इस वजह से।
सर्दी है उसको, थोड़ा सा रनिंग नोज है, टॉन्सिल में भी स्वेलिंग है।
Tonsil में swelling. How to examine the tonsils in children?
क्या पिया? ठंडा
ठंडा वगैरह बाहर कुछ भी नहीं खाया।
ठंडा पानी पिया?
No water.
नहीं बाहर
No
कुछ भी
juice.
नहीं खाया। हम लोग घर पे गए और खाना ही खाया घर पे जाके।
दुख रहा है? पगमा दुखे છે?
No pain in the limbs. It means not. It was not an inflammatory fever.
निकालने का नहीं 5 मिनट।
There was no infection, but just a fever.
कर लेना पड़ता है।
घर पे नहीं सुनता है नहीं?
नहीं,
घर पे तो उसको खुद को चेक
दूध नहीं
करना
पीता।
इधर इधर लगाने देता है।
हाँ मस्त। अब देखो हाथ हलाता भी नहीं वो 5 मिनट
वो
तक।
तो फिर खुद ही निकालता है देखता वापिस रखता है वापिस निकाल के देता
और वो बटन दबाते रहता है।
डॉक्टर पेंटे कौन है? कौन है?
His nose was completely blocked
प्रचीत।
because of running nose.
किसको चेक करते हैं?
आप मैंने गुस्सा कर दिया
किसको चेक करते हैं? सबको
He was examining
चेक करते हैं।
his parents as a Dr. Pente at home.
डॉक्टर सारडागंज जानो, पेंटे को जानो।
Want to go towards allopath or to homeopath? He said, I want to go Dr. Pente only homeopath.
मैंने कहा जाना है डॉक्टर साइडा के पास
Fine.
नहीं जाना है, वो गुस्सा कर देते हैं
So on examination, his fever was 102, right? Yeah, where is the case? Yeah, fine. So this was the history of traveling from Yatmal to Karanja at night with the cold wind, and then he developed fever. But one point is sure that there was no pain in the limbs. He was not toxic. As our previous patient was toxic, he was completely stupefied, dull. So means there was an infection. Now how to go with this case? Okay. So in my observation, here I am coming to the exact observation. In my observation, there was the redness of cheeks on his face. Okay, during fever, and the thirst was very very marked, very typical. Okay, mother told he was crying and restlessness in the night all the time during fever. So in our totality, there must be a etiology. Okay, and the observation, because this was the only factual things what we have, and we cannot go without that. Okay, so this was the case. Now let me know what are the important points in this case, or what do you think how we can go with this case? What are the important rubrics we can take, and then we can select the remedy? How we can use the art of separation of totality? Can we take a separate totality of fever? Can we separate totality of what we have etiology, or the mentals in this case, and then let me know what can be the remedy. Okay, acute rheumatism deficits. Okay, fix redness heat during obvious fact. Yes, tell me the remedy, my dear friend. Yeah, Dr. Rohan, I will come to your question at the end. Okay, so yeah, anyone wants to give the answer for this case? What can be the remedy or what are the rubrics? Okay, fluoric acid, Dr. Sharma said. Okay, dalka mara, good option. Jete jete thandi vara, tete tete dalka mara. Chamomilla, yes. Dr. Priyanka, you are quite close. Razina said chamomilla. Again chamomilla. Dr. Razina, yes, closer. थोड़ा और close आओ. थोड़ा और सोचो. What can be a remedy? No, red chicks with fever, thirst, etiology by cold wind, restlessness, uncovering. These are the rubrics. Sanguinaria, okay, good option. Yes, good suggestion, Dr. Zan. Sanguinaria, can think of. Ethuza, wow. Dr. Pallavi Super said it can be Ethuza. Yes, Ethuza also having this kind of a fever. But then why not Euphrasia, acrid coryza, redness? Why not pulsatilla, redness of cheeks? Why not belladonna, redness of face with fever? Think also like this. Okay. So yes, come to the point. So again, we are going to use the fever totality. Okay. Again, we come to the totality of fever only. So in this totality, we have exact etiology that fever hit cold taking. Fever hit midnight about again 2:30. 12 बजे उसका fever आया. Always consider the time of fever. Always consider the periodicity of fever. Always consider the fever. It's a day after or every week or after every year, after every 1 month. Always consider this because these are the factual things what we know now. Then fever modality, then fever hit uncovering desired for. High grade fever, sleep during. So fever starts after getting the sleep, after getting the bed. Okay, fever hit inflammatory fever. These are the points. What else? Other totality. Then now we are going to understand other totality. Throat inflammation, sore tonsils. Okay, because it was a kissing tonsillitis. There was inflammation. There was a congestion in the throat, and that's why it can be a fever. Redness cheeks. This is the exact observation we have. Okay, small quantities of thirst for fever during it. Sleeplessness fever during रात भर डॉक्टर सोया नहीं, वो 2:30 बजे से 12 बजे सुबह 6 बजे तक. He was completely restless. He was irritable. Covering मत करो. That was the scenario. Then other totality we have. We are going to merge up all this totality, and now here we have remedies. Okay, Lycopodium, Noxomica, Aconite, China, Sulfur, Pulsatilla, Chamomilla, Arsenic, Rustox. Okay, now in this case we give again him Rustox from the Anacardiaceae family. And now try to understand what is known for Rustox is given the remedy which is important in damp, rainy weather. Okay, are you with me? Aho, soye to nahi ho? Okay, so after giving this remedy, after giving this medicine, after doing the separation of totality in fever and other totality, here we have the Rustox. After giving this remedy, he was completely better. He was not on paracetamol. Okay, in my clinical practice, I always used to go with like this. Okay, so this is my humble request. Just directly don't go with a few rubrics. Directly never go with a few, only with the few, we can say, symptoms. Always follow this. Okay, so another important point, 6 point is sensitivity. Okay, then concomitants. Always give importance to the concomitants also. This fever comes with the pain, fever comes with the diarrhea, fever comes with the burning sensation, fever comes with the tingling sensation, fever comes with like running hot water into my veins. Okay, fever comes with the vomiting, coldness of fever. There are so many rubrics you can use in your clinical practice when dealing with the fever cases. Okay, then important part is that local modalities, always consider it. Then clinical examination, try to understand the tongue. In Boric it's given so nicely. Now tell me the remedy. Example, take map tongue with fever, white tongue with fever, cracks on in the middle of tongue with the fever. foul smelling, offensive smell of mouth with the fever. Okay, these are important. But try to understand pharyngitis. Okay, so a patient comes with like small child come with the fever and only with the URT and running nose, only with the fluent running nose, nothing else. And while swallowing that saliva, he used to do that. No, mother told doctor he feel nauseatic in fever. He's not able to remove out his balgam, but he will nauseatic in his high grade fever. Just fluent running nose. What to do, doctor? Always think of ipecaculine. Okay, always think of ipecaculine. Okay, doctor, we had went to the garden and my child उसने ना उधर पाव भाजी खा लिया. After eating pav bhaji, he develops the fever. Doctor, what to do? Think of Prastox, not arsenic. Think of Prastox. Okay. Doctor, my child develops, severe pain in abdomen. Okay. And now he develops the fever. And now he have a little bit loose motions. And there was a irritation at the anus. There was the redness at the anal region while washing and he developed the fever. What to do? Think of MacFoss. Simple remedy. Doctor, my child develops, greenish chapped uh, stool after eating something outside what to give, and he was in fever. He was restless, severe abdominal pain. He always want to be on lap. Kabhi idhar lo, kabhi udhar lo. This is a typical characteristic of the stool. Think of chamomilla, right? So, while taking the case or while dealing with the fever management, think of these like specific and little points. Okay. While dealing with the chronic cases of like renal cases, jaundice, you will have also the other totality. But never forget these things points. I hope so. This is now we have to finish, and I will come to the second part of dealing with fever cases along with these remaining points like sensitivity, concomitants, local symptoms. Special part I will going to take a session on clinical examination. This will be the most important part in your clinical practice to understand a clinical examination. I will going to take a session on this. Okay, and then try to understand the physical chandra. This is also important. Okay, so at the end, these are the cardinal steps I have been sharing with you. Even though last few lectures, these are the important 7 steps you can use in acute cases or fever cases. Listen and observe. Take only factual things. Don't use your mind. Always give the importance of etiology and excitement cause, diagnosis, modality, current mental states, sensation, and portrait of the acute and the fever locality. For the beginners, you must need to follow these 7 cardinal steps. Okay, in acute and fever cases. ये 7 steps में से अगर आपको 5 points भी मिलेगा ना, तो you will run your clinic like anything. Patient का line लग जाएगा. You will be happy with this. This is the 7 steps. For the fever, there are 12 to 11 steps. I will also come with the second part. Okay, now come to the important point. Why I came with this lecture with the fever? Because to the next Saturday, we are coming with the session of homeopathic management in COVID fever, second wave. Dr. Shakil and Mulani and me are coming together for this session. So that's why I came to I come with this session. This is the basic session of fever, how to manage the fever. Then into that session, you cannot ask me, sir, ye kyun liya? Why you took that rubric? Why you give importance to etiology only? Why you give importance to concomitants? Why you give importance to observation? Why you give importance more to the blood reports? Okay, so as I told you that if there is a cytokine storms in the COVID and fever, they should only develop the dryness of mouth and in the throat, and he develops the shivering. Think of ferrum phos. Open the boric, read the first line of ferrum phos in generalities. What is given? Okay, whenever there is an inflammatory stage of mucous membrane or inflammatory stage of cells in the blood, always think of ferrum phos is the first choice, not the China, right? If the patient develops the fever with the abscess, if patient develops with the shivering with the chills with the abscess, chills with the bad injury, okay, shivering and high grade fever, what to give? Always think of pyrogen. If patient develops the fever and the chills just after surgery, doctor, he has done surgery, but again he developed the fever, what to give? Pyrogen is given in Matramedic, is given in repertory. Go like this way. You can also give the remedy to the ICU cases. You can also give the medicine like this way for the fever in hospital cases. Fever with purpura, fever after delivery, fever after seizure. Go with pyrogen. There are so many indications. But wanted to tell you that, my dear friends, go like this wise. This is the strategy. This is managing fever. And if you go with these strategies, it's like a calculation. You have only 12 points. You have to take all these things and you consider this, you will get the remedy like this. Okay. So don't think I feel that I feel patient feel that he is not better. That's why I give it. ऐसा नहीं चलता. In your clinical practice, you have to give more importance to observation, factual things, investigation, modality, etiology, and other points. That's it. Okay, that's it. This is the most important point to go to run your clinical practice. Okay, there are so many doctors who wanted to start their clinical practice and they want to earn their bread and butter. Follow this. I also did in my initial stage. यही है. Whatever food I am sharing you, this is my clinical experience, right? So there are almost 42 doctors, and this is time to go for now answer and question session, right? If you have any question and any answer, so let me know. Dr. Aarti and Dr. Mukesh, IT, can you unmute them? Yes, Dr. Rohan had one question about rheumatism. Sir, please start a course. We will learn a lot from you. Yes, my dear friend, we are coming with many sessions. Yes.
So Dr. Archana Gupta is asking, if patient is not willing to give history, so how to take the acute case?
Dr. Archana Gupta from Akola, right? How to take a short history in acute fevers with only some symptoms like fever with cough and weakness only. So you can take this history, no? Fever with cough, fever with weakness. Okay, if he is not able to give history, ask his relatives what was the cause. If there is no relative, observe the patient. Okay, so these are the few important points. Ask him since when you have a fever. What do you think? What will happen? What was happen? They will tell you. Okay, these are the fever में आपको you cannot take a history for a 1 hour man. Fever patient बोलेगा जाता है मैं तुम पूछते रहो मैं जाता मेरे को प्रवचन नहीं सुनना है. You have to just in short. It's like you have to do a general practice in homeopathy. This is called a homeopathic general practice to handling a fever and acute. Okay. Yes. Sir, potency selection and the repetition in fever cases. Pallavi Chopra. Okay, fine. So, Dr. Pallavi, if we have a mostly I used to give 30 and 200 potency till and until there is no prominent mental. I would like to give one short case of a patient. One patient came to my waiting room and he was so anxious to told me, he was fighting with my compounder. I want to meet a doctor. I have a fever. I will die. Doctor, I just want to meet him. Okay. He was so curious. He was so anxious to meet me. What was the problem? Only fever. Only fever. And he was constantly telling me, doctor, you know what happened? I went into the marriage and I think they put something into my food, and that after that the fever develops. I feel they have given me something, doctor. Do something, do something. So fever was only about 100, okay, and he was constantly telling this, do something, do something, okay. So what was that? That was a mistrustfulness. That was a suspiciousness strongly along with the fear in the fever. I gave him hyoscyamus, only 200 2 He was completely built. Okay. If there is a more prominent symptoms, doctor do something, fever बढ़ जाएगा तो मैं मरूंगा तो नहीं. डॉक्टर ये फीवर बढ़ेगा तो कहीं कुछ अलग से तो नहीं हो जाएगा, मेरे को कोरोना तो नहीं होएगा. डॉक्टर डू समथिंग. If patient is mostly on region level, you can go to the higher potency. And if you have only factual thing, go with to 200. Don't think. If patient is telling that doctor I have a fever and I think the burning is fire like running into my veins, go with the arsenic one. Because rather than fever, he has more prominent of that sensation, burning sensation. Okay.
Dr. Pravin,
Yes.
there is one question over YouTube by Dr. Yogesh Bankar. He's using BBCR repertory and he wanted to know what other books he can use
For the fever.
Yeah.
You can use BBCR repertory, you can use Patak repertory, you can use Murphy repertory. There is also a very small chapter in Kner repertory. It can be useful. For the references, you can go with Farrington, Bonington Mater Medica, Patak Mater Medica, Boric Mater Medica, Allen's Encyclopedia. Then you can go with mostly what I use, that Lilienthal Mater Medica. So go and read. We'll get most of the ideas. There is also a fever repertory also is there. There is also acute repertory also there. Okay. So these are the important points. Okay. You can go with, right. Yeah. Any other question?
Any other question, Dr. Arti? You too?
No, from my side, all is clear.
Okay.
Yeah. I think in Zoom also there is no question.
Okay.
So can we conclude the session?
Prophylamine. Wait.
Yeah.
Prophylamine, acute rheumatism, disputes fever and pain. Fever with RA. Yes. So see, fever with RA is also very common. Okay. But if fever goes high, then also you can think of a fever with RA, think of a laden. Think of a lycopodium. Okay. So why I'm telling you, if you have any symptom, if you have any query, try to go with the repertoire and confirm it from the Mater Medica. Okay, confirm it from Mater Medica. And Dr. Archana, if patient is not willing to give history, at least you can observe. At least you can take some factual things, whatever is there. You can follow, you can touch the patient, you can touch his toes, you can touch his palms, you can touch his sole. Okay, the patient comes with the high grade fever, shivering, chills, and only coldness of palms and soles. What is the remedy? Hello, this is the last question. Okay, what is the remedy? The remedy is Mars. Okay, go and open the boric matremedic, open the fever, open the extremities. I see coldness of palms and soles with the chills, high grade fever, and severe body ache. You can go with Mars, right? This is the way how we can go with. I hope this will help you to go with your clinical practice. And I will also I will again come live with the second part of fever management, right? And don't forget, the next Saturday on 5th of February we are coming with Dr. Shakil Mulani from Mumbai. He's one of the great physician, great clinician in Mumbai. He's running his own clinic and he has all kinds of pathological, critical, COVID, cancerous cases. So he and me would be love to share our fever cases and other critical cases of COVID, the second wave, what we are suffering as if now with the infection, influenza, viral fever. We'll be coming with this. So for these sessions, fever session, please let us know your feedback. You can contact with Dr. Mukesh Jaiswal, Dr. Ati Mutwani. You can mail me directly also if you have any question. And please subscribe our channel and put your feedbacks, put your suggestions, put your questions to us, so we can come with more and more knowledge. We can come with more and more raw clinical knowledge with you. And I hope I could reach you in this session. And I will try to, come with more sessions. I will try to come with more ground level understanding of my own understanding of my own clinical experience with you all. Thank you so much. Okay. Yes. So Dr. Mukesh, you can conclude the session.
Yes, sir.
Yes,
Yes, sir.
please.
Thank you, sir. It was a very amazing session. We learn a lot, and I think participants also learn a very lot. And after this session, maybe they can get an idea how to approach a fever case. And you have beautifully explained all the points what I have to consider in fever cases, the journey of disease, the clinical examination, and you also told don't reply on just repertory. You have to check with Mater Medica also, physical examination.
Hmm.
So it's a very fantastic, and we are also coming with our new webinar.
Upcoming webinar on 5th of February,
webinar.
Saturday, with Dr. Shakil Mulani on COVID cases,
So
homeopathic
registration is
management.
going on. Yeah,
Yes.
registration is going on. So you can WhatsApp, you can contact us. Thanks a lot.
Yeah. And hopefully, we are coming live on every Saturday in few days with me only, with very small clinical cases, little bit clinical tips for all of you to which tips you can use in clinical practice. And best wishes for me, Dr. Mukesh, Dr. Neha, Dr. Aarti, and entire team of Dr. Pente's Advanced Homeopathy and Research India. Thank you so much. Bye and take care. IT, I think we have to stop the session. we can end the meeting.